We are near the end of the resources to use during MBBS series. We are covering the 3rd and 4th year subjects today. Hello everyone, I am Dr. Swami. Welcome back to my channel. Now I am clubbing the 3rd and 4th year together because I myself didn't use too many books or resources for this 2 year. There's very little time, and along with studying for the professional examination as well as improving your clinical skills, you have to start preparing for the PG entrance examination. So in this video I'll share the minimal resources I myself used during the last 2 years. Starting with PSM, PARC is the gold standard. Contrary to common opinion, I like PARC, especially the infectious disease part is covered very well, and it will suffice to read that topic even for medicine and pediatrics. For topics like health programs, I used Marrow notes because it's very concise and it removes the fluff that these books have. For other topics like health and disease, screening, biostats and epidemiology, I used Marrow notes, but you can use any resource. Also, Vivek Jain's review book is a very good resource for revision. Coming to medicine, Harrison is the gold standard, but I had bought this book but I seldom used it. I used Marrow notes for medicine. I started loving medicine because of Rakesh Nair sir's video. Even though the videos are vast, it helped me get an overall understanding of the diseases. Sir starts each unit with the relevant physiology, so it gives you a wholesome learning experience. I also used Matthews for reading certain topics in GI and Respi before the examination. I had used Harrison for reading the flow charts in the symptomatology part before the professional examination. This is a must for everyone. Everyone should read the flow charts given in Harrison. But try out Marrow and see if it works for you like it did for me. It's for medicine specifically. For practicals, you can use Hutchison or MacLeod's clinical practice book for the conceptual learning and Arup Kundu for passing the examination. For surgery, the gold standard is Bailey and Love. It's apparently a very good book according to some of my friends who have used it. I personally didn't use it. I made combined notes from DAMS and Marrow. Dr. Rohan Khandelwal is a great teacher with concise to-the-point notes. For practical purposes, I used SDAS for the theory aspect of each case and then focused on history taking and examination. For obstetrics and gynecology, I again used Marrow notes of Dr. Sakshi Arora. I had 2 books, Shaw's Gynecology and DC Datta's Obstetrics, but I used them only for the tables, images and a guideline for writing answers for the professional examination. For pediatrics, our classes were really good in college, so I mainly focused on class notes. After going through the class for summarizing each topic, I used to read OBG. This again a must-read book for every MBBS student. For practical specific to pediatrics, I read the general pediatrics section from Meherban Singh. Now, for the practical aspect of all these 5 subjects, you have to attend clinics. That is non-negotiable. What you learn from seeing the patients, taking history, doing examination on real patients can't be replaced by any other resource. So don't miss out on attending clinical postings for reading the theory or preparing for the PG entrance examination. Coming to the shorter subjects, for dermatology, I read from Malcolm Pinto sir's classes in Marrow, and then I used to flip through Neena Khanna for images. For psychiatry, I attended Sachin Arora sir's class in DAMS, and then I added on certain information from Neeraj Ahuja. For orthopedics, I made a combined notes using Abbas Ali sir's classes in Marrow and Tushar Mehta sir's classes in DAMS. Both of these are really good teachers and you can use any one of them. I had also bought Maheshwari for orthopedics, but I didn't use this book. For ophthalmology, I mainly read from Rajaratna ma'am's classes in Marrow. Additionally, for the professional examinations, I went through all the classifications for all the diseases from A.K. Khurana. For ENT, I mainly used Manisha ma'am's notes from Marrow again, and I used to flip through Dhingra for fun. That's all. That's all the resources I ever used during my MBBS days. As you can see, in third and fourth year, I used Marrow and sometimes DAMS for a lot of subjects. And the reason for that is that we don't have much time in third and fourth year to read thick standard textbooks, because the competition is so tough and we want to study smart to utilize whatever time we are left with. And because I could save time there, I could use that time to regularly attend clinics so that my clinical skills aren't hampered. You have to choose your battle wisely between reading standard textbooks versus reading from coaching notes while not missing out on your clinical postings. This much for today's video. Hope it helps you in some way. Hit the like button if you like the content or the effort. Comment down below any other MBBS related videos you want me to make. I'll surely come up with those videos in future. Also, subscribe to my channel and press the bell icon so that you don't miss any of my future videos, which I upload every Sunday at 11 AM despite my busy doctor life. Thank you for watching today's video and have a nice day ahead.